for the purpose of residents giving a intravitreal injection, just wanted to show the procedure, how it is done. And all ophthalmology residents should be well versed with the intravitreal injection. Now this is a ranibizumab injection. A ranibizumab injection, which is called as Ozibab. So this is the injection that we are going to give for the patient. The patient is actually a right eye, he has got a total glaucomatous optic atrophy. In the left eye, he has got a central retinal vein occlusion. It is very unfortunate, even though he had glaucoma in both eyes, because the patient is hypertensive, he has developed a CRBO. Now it is very, very important that we have to save at least the left eye. The right eye is almost total glaucomatous optic atrophy. Vision in the right eye is 1:60. In the left eye it is 2 meters only. So we are taking this patient as an emergency, and before planning for intravitreal injections, the ophthalmology resident should be ready with certain things. So one is the injection. So this injection comes in 0.5 milligram in 0.05 ml. So you take the injection, and then this is the kit that you get along with the injection. Now if you look at this, you have a few markings here. If the patient is pseudophakic, the anatomical landmark will be from the corneal limbus. You have to make a mark from 3 to 3.5 millimeters. Now if the patient is phakic, because of the lens thickness is higher, now you have to go to 4 millimeters and make a mark. So either you get this ready-made with the injection kit, or you can use a scale like this, which is also a sterile scale. You have a marker here, so the same biomarker can be used to make the mark. So the anatomical landmark is very, very important, because you have to inject through the pars plana only. So anteriorly you have the lens, posteriorly you have the retina. So you are working in a small zone, so the marking of the anatomical marking where you are going to give the injection is going to be very, very important for the residents. Now when you are taking the injection, so you are going to take this injection, and so this is a 1 ml syringe. You are going to take 0.05 ml, and then you inject exactly towards the optic disc. You direct the injection towards the optic disc. Either the surgeon can himself give the injection, or you can ask the assistant to press the injection. Then you slowly withdraw that, and then once you are done with that, you close the injection site with the bud. Image of the intravitreal entry through pars plana. So this is a patient. We have made a blue dot 3 millimeters from the limbus, because the patient is pseudophakic, and there are markers available for that. And then now we are going to inject exactly through the point that we have made. So we are giving the injection, the drug is delivered, and then the injection is slowly brought out, close the wound with the bud.